And for our poster project, I did some research on Ehlers-Danlos syndrome, which is also called EDS. To introduce you to it, I have some information. Like Ehlers-Danlos syndrome is a genetic condition, and it actually consists of a group of disorders. Ehlers-Danlos syndrome affects many different connective tissues of the body, and it makes them weaker than they are supposed to be. The NHS says that connective tissues provide support to skin, tendons, ligaments, blood vessels, internal organs, and bones. Therefore, EDS can affect a range of many different things, such as your joints, which include pain, hypermobility, and contractures, which limit the range of motion. It can affect skin elasticity, fragility, and cause loose and excessive skin, as well as it can affect your organs, gums, causing gum disease and tooth loss, poor muscle tone, weak muscles, bowing limbs, and it can make you shorter than you should be. It has a craniofacial feature effect. It can affect your eyes and other things like your heart valves. It can cause hearing loss, foot deformities, leg swelling, and the list goes on and on. Ehlers-Danlos syndrome affects the collagen formation and function in the body. Ehlers-Danlos syndrome is considered a rare disease because a rare disorder is about 1 in 2,000 or less prevalent, and it has a general prevalence of about 1 in 5,000. So it's over double to be a rare disorder. And the prevalence in the different kind of EDS differs per each kind, because we have 13 kinds of EDS, and the most common is hypermobile, or HEDS, but there's 13 different ones. In 1998, EDS was published with the classifications, and the genetic makeup was discovered in the 1960s. In 1901, Edward Ehlers recognized EDS as a specific disorder, and in 1908, Henry Alexander Danlos suggested that the skin being fragile and its specific characteristics were related to a patient with EDS. Since hypermobile EDS is the most common type, I have a list of symptoms that somebody with hypermobile EDS maybe have. The other kinds of EDS may also have these symptoms, and then other symptoms as well. They have things like joint hypermobility, unstable and loose joints that can dislocate, joint pain or joints that click, fatigue or extreme tiredness, easily bruising skin, digestive problems. They may have things that relate to dizziness, organ prolapse, problems with your organs, and incontinence. Typically with HEDS, you have a normal lifespan, but with other types of EDS, it may go down. The biggest ones to affect the lifespan are the ones that deal with like blood vessels in the heart, like vascular EDS, which also increases the risk of death due to the possibility of internal bleeding. There was 3 cases of sudden death that have been recorded from this type of EDS. 2 of the deaths were a result of hemothorax, which means bleeding from the pleural cavity, and it was because of the dissection of the aorta, which is the largest human artery, and the subclavian artery, which is also a major artery for the upper body. And then the 3rd case of death was due to a spontaneous pulmonary rupture and hemorrhage, which means there was bleeding from a ruptured blood vessel. And it was all due to the fact that the connective tissues in the patients with EDS were weak, and it put pressure on them, causing perforations. Many people with EDS, the vascular EDS, will only live to be about 48, and most have a major medical event before they are 40. Other than those facts, a person with EDS should live a normal lifespan. EDS is diagnosed through examination and sometimes genetic testing, but a family history and loose joints or delicate skin are sometimes the only way a doctor can make a diagnosis. A genetic test using a sample of blood can be used for some forms of EDS, but it has to be the more rare types, as HEDS or hypermobile Ehlers-Danlos syndrome is based solely off of the medical history and examination, because there's no genetic testing for that. Since the connective tissues are thin in a person who has EDS, it can cause vessels and organs to rupture more easily. And it can cause more conditions such as strokes, which is a clogged artery in or to the brain. It can cause a tendency to bruise more easily, internal bleeding, intestinal perforation, which is a hole in the intestinal wall. And it can cause more conditions such as POTS, which is postural orthostatic tachycardia syndrome, and it's linked to EDS due to blood flow issues revolving around the thin vessels, which is due to the EDS. It can also cause neuropathy, sleep disorders, and anxiety is also linked to EDS. The POTS disorder is when the heart rate and blood flow are affected when a person stands up. And all of those conditions are linked to EDS because of the thin connective tissues, which cause other issues within the body. There isn't many treatments for EDS at the time. Many people with EDS take over-the-counter medications for pain, like Tylenol, Advil, Aleve. They may have a prescription for a blood pressure medication if they do have thinned blood vessels and such, so that their vessels won't perforate or tear. A lot of people will be recommended into physical therapy to strengthen their muscles and stabilize their joints so that they don't dislocate their joints in the future. And when they go to therapy, their therapist may also choose braces to help them stabilize certain joints so that they don't dislocate them. The continuous dislocation of their joints may cause a need for surgery to fix the damage done to the joints, as well as ruptured blood vessels and organs can cause a need for surgery. There are also clinical trials for EDS. Right now there are 79 studies according to the NIH clinicaltrials.gov website. There are many lifestyle changes that people with EDS can do to help their bodies, like when they're choosing physical activities, choose something that's gentler on the body, like swimming or yoga, rather than things like heavy lifting or boxing. One of the clinical trials I looked at was for a drug called enzustaurin. They're also looking at things like oxygen therapy, compression garments, and there's a whole list of different things. Like I said, there's 79 different studies. When you get down to the personal level, the quality of life can be impacted in a negative way for people that have EDS, as pain and fatigue are two major problems with having EDS. Fatigue is related to somebody's pain worsening. poor social function, sleep disturbances, concentration issues, and other things. And pain can cause depression and anxiety and other things like that. EDS has a general prevalence of about 1 in 5,000, and about 1 in 12,000 individuals are affected by hypermobile EDS. About 1 in 30,000 are affected by classical EDS, as well as about 1 in 30,000 for classical-like EDS. Vascular EDS is only prevalent in about 100,000, as well as cardiac valvular is about 1 in a million. The averages, these are just averages of the different ranges, going from the Ehlers Danlos News website. But if you wanted to go back and look at that, it's the 4th reference. There isn't a whole lot of information about how EDS affects different parts of the world, but it does tell us how many people are affected by each kind of EDS. Society's response to EDS is there's not a whole lot of education currently, but we do have those 79 clinical trials for treatments on the disorder. But there are no cures for the disorder. There are few treatments. Most of it is for management, and some are temporary, such as surgery, where you may have to keep doing it again due to the bone damage. But places like the Ehlers-Danlos Society is working towards further education revolving around the disorder, as well as pushing forward treatments.